is National Cancer Prevention Month. Austin CyberKnife is dedicated to helping reduce the risk, prevent, and treat the disease with innovative and advanced technology and dedicated attention to their patients.
My name's Stephen Brown. I'm a radiation oncologist here at Austin CyberKnife. Been working with this facility since it opened 11 years ago. Radiation oncologist is actually a cancer doctor, but how we provide treatment is through radiation. So our tool is radiation equipment. At the CyberKnife, we have a linear accelerator which actually projects a radiation beam, and it's hooked up with a car robot. It's very accurate and delivers radiation very precisely. CyberKnife is typically employed when we're trying to treat a very specific target that's delineated well with imaging, CAT scans, or MRIs. And so we don't treat large fields. They're very small fields and they're pretty precise. Conventional radiation typically takes 42 treatments, 2 months, 2 days to deliver the radiation in small doses, 180 to 200 rads a day. At CyberKnife, we can perform the same treatment with similar outcome in 5 treatments. Each treatment is 750 rads, so that's almost the equivalent of what we would deliver in 1 week in a standard form we do in 45 minutes here at the CyberKnife. One of the things that we do treat a number of patients with is for prostate cancer because it's a very defined target. When treating those men with prostate cancer, typically I'm looking for early stage disease. We have an 8-year track record that's roughly equivalent to standard radiation techniques in surgery. People with more intermediate grade prostate cancer, typically we use combinations of standard beam radiation, and then we may use CyberKnife to boost the dose of radiation to the prostate.
CyberKnife is one of the methods that's very handy for retreatment because your body has a memory for radiation, and let's say you've already been radiated for a lung cancer, but another spot comes back within that radiated area, then CyberKnife is just perfect for just targeting that area. I've treated several people with head and neck cancer that are 20 years out from their prior treatment and they have a recurrence, and so you don't want to treat a big field, you want to treat a real focused field. So CyberKnife is just, it's not only is it designed for small early cancers, but it's also designed for recurrent tumors where you're trying to shield the normal tissue. Because of this phenomenon with radiation, your body has a memory for it.
Before each treatment session for any of the patients, the therapist, the radiation therapist, myself, and the radiation oncologist assemble at the treatment console and do what's called a timeout. That we identify that this is the right patient being treated for the right area, and that the treatment plan we're going to be using is the exact treatment plan that needs to be delivered to this patient at this treatment session.
The response from patients has been emphatic. Folks are delighted that they can get their treatment done in such a short interval of time. In terms of symptomology or side effects associated with the treatment, they're minimal. Most patients get through this without any side effects whatsoever. So it's efficient, and our patient satisfaction is high due to the outcomes being equivalent to long periods of radiation or surgery. So in looking for this technology, the Austin CyberKnife is the one dedicated freestanding facility for CyberKnife treatment in the Central Texas area.
Austin CyberKnife is located on I-35. Call them at 512-324-8060 or go to austincyberknife.com.